Hello, everyone, and welcome to the fourth of my six Zoom series, where I put out free educational information for anyone seeking it on CRPS. Much of the information available about CRPS is misleading or inaccurate, and it often originates from unreliable sources. And unfortunately, this misinformation tends to perpetuate fear and confusion about the condition, and believe it or not, prevents patients from having an effective road or path towards remission/recovery. So my objective with these Zoom meetings as a doctor of physical therapy and pain specialist who also was diagnosed with CRPS 10 years ago is to bring you solid and up-to-date information to help you on your journey through CRPS and back to a meaningful and fulfilling life. If you find these videos helpful and you want more information, more free worksheets or activities, etc., you can go to my website, thewindowpain.com, and you can join my mailing list. On February 1st, I'll launch a program, self-guided, a very cheap program that will help you go through kind of learning about how to find a way out of CRPS and a path to at least a more meaningful life, hopefully without pain, but if not without pain, at least with significantly less pain. These are techniques and things that I use with my patients all the time at one of the largest hospitals in the country, and also that I use with my pain coaching clients who I see from all over the world, including the UK, Australia, Canada, and the US. If pain coaching sounds like something you might be interested in, that is a one-on-one customized coaching relationship where I help you find yourself again and give you the tools the very same tools that I use and I use with some of my patients to recover or reach remission from CRPS. So if that's something that's interests you, you can also go to my website, thewindowpain.com, and click on the Get Scheduled button, and then you'll be able to schedule a free consult with me to see if pain coaching is a good fit for you. But otherwise, everything I'm putting out is completely free, free information, free videos, free education. So you can start today finding a path for you to a more fulfilling life. If you enjoy these videos, please do like, and if you're up for it, subscribe to YouTube. That helps other people suffering from CRPS see these videos and get the same information. So I would greatly appreciate that. Or share it with other people you might know experiencing CRPS. I really appreciate you guys tuning in. And if you have any questions, comments, etc., that you want addressed or answered in another video, I do a Q&A every week. So go ahead and put any questions down in the comments below. I'll do my best to answer them there. And if I don't, I'll answer them in the Q&A that I try to put out every single Friday. Thank you again so much for tuning in. I'm really excited for this Zoom, the title of which is CRPS Spreading Stages and Remission. And I'm excited to address some of these things and put out some good information about it. So thanks for being here, and I hope you enjoy. One. Okay, we are live. So welcome everyone. This episode is going to be covering stages, spreading, and remission. We have a decent amount of people here, so I want to ask that if you're not speaking, please try to be muted. We love to hear from your dogs and cats, but as much as you can, being muted is helpful. Uh, Additionally, if you have any questions or comments, go ahead and type them in the chat. As I go, I will try to answer them or take built-in breaks as we go through this presentation. Okay, let's just get started. All right, here we go. Share, Zoom, sound. Okay, can we see the PowerPoint?
Yes.
Okay, so we are recording. Perfect. Okay, so as I said, this session is called Stages, Spreading, and Remission. This is episode 4. My name is Chase Teagarden. I am a doctor of physical therapy, a therapeutic pain specialist, and a fellow of pain science. What that means, so we'll move to the next part, is that I received about 10 years of education with my bachelor's degree, my master's degree, and then my doctorate eventually in physical therapy. Then I did a 6-month program to become a therapeutic pain specialist through Evidence in Motion and Purdue University. And then I did an additional 2-year program to become a fellow of pain science through Evidence in Motion. So I live and breathe chronic and complex pain. It is my passion, and this is why. In 2008, I had my first incidence of back pain. This was kind of on and off back pain for a period of time. I'd do the whole gambit, go to chiropractors, physical therapists, you name it, I did it. And then eventually I ended up having my first back surgery in 2012 on my L5-S1 vertebral disc. I felt better for about 6 to 8 months and then started to have back pain again and ended up having an additional back surgery on the same disc in 2013. 6 weeks following my surgery, pain in my left foot began. And for about 8 months, it progressed in severity. I was put on all the medications you see there on left or right. I'm not sure how this is looking in the Zoom. And kind of left with not many answers. And I had to search for a diagnosis like many of you. I asked neurologists to cut my leg off. I contemplated taking my own life and obviously eventually was diagnosed with CRPS. I suffered with that for quite some time, and I started to go on the road of rehabbing myself and eventually had to make a decision to try and push forward. In 2016, I was almost completely pain-free, becoming pain-free completely after about 4 years of this journey with CRPS. So, from that, of course, I went on to become a doctor of physical therapy and pain specialist. I actually initially was going to school to be a dentist. Okay, next one. So let's start out this presentation as I've done before with what is pain? Pain is defined by the International Association for the Study of Pain, so the leaders in pain. It is defined as an unpleasant sensory and emotional experience that is associated with or resembles the association with actual or potential / perceived tissue damage. So that tells us a number of things. It tells us that pain is complex. It also tells us that pain sometimes has to do with actual damage and sometimes it does not. And it also informs us that pain has an emotional component as well as the sensory component that we feel. Good examples of this are something like a heartbreak. There's no physical damage, but we do feel pain. Something like a paper cut, that's super small, but very, very painful. And then further things like a gut feeling or the phrase backstab. All of those things have a pain element to it that doesn't necessarily have anything to do with physiology, but sometimes an emotion could change physiology too. So as you can see, pain is quite interesting in a number of ways, which is why it's studied so rampantly. Okay. Why is it important that you know what pain is or what's happening with your body? Well, understanding pain, believe it or not, actually reduces your pain. So here on the slide here, there's a bunch of studies that demonstrate that as you explain pain, people will actually have less pain. So that's a big reason for these presentations is me helping you understand what is happening to your body will actually reduce the fear around what is happening to your body. And why that's important is because fear and anxiety are processed in a brain region called the amygdala, and the amygdala is heavily involved in our pain experience. So if we can reduce fear and anxiety by by virtue of doing that, we will reduce activity in the amygdala and reduce pain. Okay. Now, so what can increase pain based on fear and anxiety? Okay, so one thing that can really increase pain based on fear and anxiety, and I know there's a few of you in here who have experienced this, but words and messages from doctors can increase our fear and anxiety. So, for example, getting something like imaging is shown in research to actually increase our fear and anxiety and our pain simply by virtue of the fact that we got an image done. Whether anything is quote unquote wrong or not doesn't matter. Just having that imaging done, it's been shown that it can increase pain. So, believe it or not, many MRI findings are poorly correlated with pain. So, if I was to go down to the Houston Rockets here and scan all of their legs, statistically, 30% of them would have torn meniscus, but no pain whatsoever. Same thing is true for rotator cuff tears. If I was to scan a volleyball team, a collegiate volleyball team, statistically, about 30% of them would have rotator cuff tears and no pain whatsoever. This is the same thing for the spinal changes. So there was a huge study that I've mentioned a few times done on 3,110 individuals. And what they found is from the ages of 20 to 80, those individuals had bulging discs, herniated discs, spondylosis, degenerative disc disease, etc. But those individuals, those 3,110 individuals, by virtue of being in the study, they weren't allowed to have any pain. So this is eye-opening because a lot of times structure doesn't have a relationship to our pain experience, but it gets blamed for our pain experience. So I want people to recognize and understand that, and maybe that helps reduce their fear of structure being a cause. This was something I suffered myself. I herniated. This is my MRI right here. I herniated my L5S1 vertebral disc. And it wasn't really like an incident that happened. I just suddenly had back pain and then, or like randomly one day, and then I got an MRI and that was what was blamed. But I look back now and I wonder, was that necessary, that surgery? So knowing the information I do now. Okay, this this fear and anxiety that raises our pain level is the most true for CRPS. The reason is the unknown is scary as hell. When we get diagnosed with CRPS, that's all we are operating in is the unknown. If you don't know what's coming, it's scary. Okay. So what happens is we get diagnosed and the doctors give us basically no answers. They say this is going to be forever. This is the worst pain anyone's ever experienced. And good luck. Ta Be quiet, take the medicine. Okay. So by virtue of that, we expect the worst. Our expectations make the pain more intense in the same way that getting an imaging and seeing something that's maybe bad or not makes the pain more intense. The pain is very real. The pain is the most painful thing I ever experienced. I mean, I almost took my own life because of it. Things that add to the pain are the thoughts and stigmas surrounding the condition. And so that's a big thing that we're going to talk about today. All right. And how many of you have seen this pain index? I think
Yeah,
everybody. Okay.
absolutely.
Yes. And it does hurt like this. I mean, I remember, there's no doubt. So the vicious cycle of pain. As I've discussed, anxiety is a big part of this. When we start to worry about what's happening with our CRPS and with our body, like for example, paying attention to all of the symptoms, the swelling, the redness, the itching, the numbing, all of that, and wondering what's going on, does this mean my body's falling apart? Am I broken? That anxiety and worry of tissue damage increases our pain. And then by virtue of that, the brain becomes more focused on the problem. So our attention draws there. Then our nervous system becomes more hyperactive, or the alarm starts going off that I've talked about before. And then we have more pain. And then since we have more pain and we try to move and and it hurts, we get more anxiety and we move less. And then there's more changes to the nervous system, and then the cycle continues. Okay? And this is even more interesting because not only is there the physical part of this um, pain cycle, but there's also the psychological part. So we will avoid activity physically. We will get deconditioned, so we won't be able to tolerate things as well because we're not being active. Our pain will decrease with activity. Then we'll have sorry, pain with decreasing activity. So less activity we have, the less pain. Then we avoid activities further because we've learned that not doing things doesn't hurt. And then we get deconditioned further. And then the psychological cycle, again, anger, anxiety, fear, distress. Our mood decreases. We develop depression. And then we have an increased perception of pain. We feel that pain more intensely because of that anxiety, fear, and distress. Okay. So, how do we break this cycle? Breaking the cycle is when we have a pain experience, instead of catastrophizing our pain, instead of having negative beliefs or paying attention or listening to this threatening illness information, and then having more fear and then being avoidant and then having depression and disuse and disability. Instead, we have our pain experience, we face the fear, become ending up having no fear, Then we can confront our uh, disability or disuse problems, and then we can walk the road to recovery. Okay, so that is how we break free from this pain cycle. Okay, next. These, how many of you have seen some of these acronyms here?
Yes.
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 And would you say that they're pretty commonly associated with CRPS?
Yeah.
Yes.
Yes,
I haven't heard of pandas, PAMS, FND. I don't know those ones.
I gotcha. So these are just other syndromes that are similar. They have the same thing in common, which is the nervous system being hyperactive and the alarm acting weird. Okay, so POTS is a situation where people, when they change positions, they can get lightheaded or have passing out. AMPS is basically it's a rename for fibromyalgia, but it's unexplained pain in a lot of places of the body. Um, and then PANS and FND, those are basically the alarm system is freaking out in such a way that there's neurological symptoms happening. The body is fine, the brain and spinal cord and the nerves are fine, but they are having neurologic-like symptoms. Okay. The reason these are commonly seen in conjunction with each other is because the problem is kind of the same. Okay. There is a lot of misconception and misunderstanding around these conditions, which perpetuates fear, which perpetuates anxiety, which increases pain, or symptoms such as fainting, tremors, episodes of like dissociation or pseudo seizures, those kinds of things. Um, okay. Next one. So, what is going on? Why is this happening? And I mentioned the nervous alarm a few times, and if you guys haven't seen it, you're about to right now. The nervous alarm. When we step on a nail, we would want to know about it, wouldn't we? Probably would be important, right?
Yes.
Okay. What happens when we step on a nail is we have a reaction in our nervous system that sends a signal. It sets off an alarm and it sends a signal up to our brain, and our brain tells us our foot has been severed, pierced by a nail. And then we go, to the doctor, or we seek medical attention, and then we wrap up, bandage the foot, and then it heals. And then what happens in a normal system, a normal nervous system, is the level of excitement from that event, that traumatic event of stepping on a nail, goes down, and we return to a normal alarm system. That's a normal system. Unfortunately, for the people suffering from CRPS, AMPS, POTS, these types of things, their alarm system has become what we call sensitized. Central sensitization. You've all heard that word before, I think, most of you. I'm trying to fix my camera here. It's freaking out. There we go. So what happens in this situation is the alarm in its normal form is way down low at the bottom, on the bottom there of the graph. And that leaves us a lot of room for activities before our nervous system sends a message of pain to the brain. Okay? Or a message that can be interpreted as pain. In a hyperactive alarm, which, as you can see, happens in 1 in 4 people all over the world, so it's pretty common. Not everyone gets a diagnosis of CRPS. They might have chronic back pain or chronic neck pain or something like that. But the situation's pretty similar. Our alarm system has become hyperactive. So doing even a small activity like lifting weights or walking or standing up or um, spending any time going to the grocery store, etc., could cause the alarm to activate and set off pain. That's where you see in blue there the little room for activities. We've become extra sensitive. So much like a house alarm that is malfunctioning or is hyperactive, we need to reprogram, reset up the alarm so that it's not doing that. And we do that through a concept called neuroplasticity. So, what can trigger the alarm? What can set us up for central sensitization? There can be a pain event, which could be stepping on a nail, injuring our back, frostbite on our toes. You name it. You could have an event that could set up the alarm to be sensitive. This happens with everyone when they sprain their ankle. So when you sprain your ankle, if you guys have done it, your alarm is going to be a little extra active for maybe a couple weeks. Okay. And the way that we calm down that sprained ankle alarm is we gradually start to put some pressure on it. Maybe we go to physical therapy. We do some gentle motions. We strengthen it up, and then eventually it's healed. Um, for these other conditions, sometimes we sprain our ankle and then develop something like CRPS, and that happens for a number of reasons. Maybe at that time in our life we were undergoing a lot of stress. Maybe we had lost some loved ones that triggered our nervous system to be extra alert. Maybe we just got in a car accident when our ankle got injured. Maybe we were under a lot of work stress. Maybe we were getting a lot of pressure from our wife to not play video games so much every night. So, all of those things could lead to a hyperactive alarm. Um, Also, other things could be medical information. So the common experience with CRPS, you're in the doctor, they say, yeah, you've got CRPS, you're screwed. And that can be a very triggering aspect of the alarm as well. Information shared by people who are suffering. While it is helpful to know that we are not alone, sometimes, especially, I'm sure a lot of you have experienced this if you're on the Facebook groups or Googling a lot, you can get hyper charged up and your alarm and nervous system can be activated pretty quickly just from that. And not even from CRPS based information, but information that you get about the election, for example, or what happened recently in Louisiana. I know I personally got noticed that I needed to turn off the news because I was feeling so upset
Yeah.
for what happened in those areas. And so that's an example again, when you start to feel upset like that, the alarm is getting activated by something that's not even physical. It's something that's emotional and mental. Additionally, stressful life events, like I mentioned, traumas. So, medical traumas, personal traumas, childhood traumas, and physical traumas can all trigger that alarm to be active. And then, of course, beliefs about our bodies. There's a few of you in here that say things to me like, my ankles are shattered and shambles, or my back is a broken accordion that's on fire and crumbling. Those beliefs, believe it or not, influence how we live our lives and influence our bodies. So there was actually a study on this. If there was a survey of people who were in their 40s about what they thought about their age. This was a long-term study, okay? So they interviewed these people and they said, "What do you think about being 40?" And they said the ones that said, I'm getting old. My bones and my joints don't work like they used to anymore. I'm not as young as I used to be. I can't recover like I used to. Those people had more over their lifespan, more disability and more issues in correlation. So it's not doesn't mean causation, but there was a correlation between those beliefs and their medical maladies and their uh, health span, not lifespan, health span, based on those beliefs. And then the other group of people that said, "I'm just getting started. I'm 40 years young. I still feel as spry and youthful as ever." There was a correlation with them having better medical outcomes, better health span overall, just from those beliefs. So belief, as I say in all of these, is very powerful. So
Chase, can I
yeah,
chime in on that?
go for it real quick.
Yeah, real quick. Just the opposite for me. Uh, in the coma, coming out of the coma, the aneurysm, the brain aneurysm, and everything. And weeks after, months after that, I had the pain down my left side.
Hmm.
Uh, I went to a doctor. They told me it was RSD. That was the least of my problems. I never researched it. They never really explained what it was. So I never really had that fear,
Sure.
and it never really affected me. I never let it overcome me. However, fast forward to 2020, I had the fall. Now I'm incapacitated. They tell me
Oh,
it's CRPS, completely, I think, different thing. And now the fear has
yeah.
come in.
And what else was going on in 2020, Matt? There was a big thing going on in 2020. The
Well,
world, the world.
2021, I lost my son,
Mm, mm,
which
yeah.
added to the stress. COVID added to the stress.
Yep.
Everything that was going on in the world added to the stress at that time. So
Yep.
Yeah, the groin injury really put me down, and with the diagnosis, it took 25 doctors just to find out what it
Yeah.
was.
And so this is and thank you for sharing that, Matt, because this is
You bet.
a pertinent example of the stacking of triggering events that lead to a hyperactive alarm. So you had this, a stroke is already a scary thing.
Sure.
Then you had the world changing and shifting because of COVID, and then you had the loss of your son, which I'm terribly sorry, by the way. And then you had many doctors giving you varying information, lack of explanation, charging up. So your alarm system just continued to charge up,
Without a
and
doubt.
then you became so alert that it's almost like you're fending off lions constantly. The body doesn't know the difference between physical stress and mental stress, by the way.
No.
So imagine you're fighting a bear. Your body doesn't know the difference between fighting a bear and juggling the complexities of a difficult time in your life. And so
Exactly.
oftentimes, and you'll see this in the groups, if you look, you'll see oftentimes people developed this right around a loss of a loved one or right around other significant life events. These are all things that are contributing to this alarm. So speaking of alphabet soup, I'd like to talk about one of the alphabets that not isn't commonly associated with CRPS, but I think you'll find it interesting. So, SUNS, sudden unexplained nocturnal death syndrome. Okay, this happened in Laos. Well, it's commonly associated with Laos, but it's Hmong men. This was a while ago, like I think 1940s. There were 117 deaths. They were mostly males. There was no explanation, so no understanding. The average age was 33, and these individuals were fully healthy, nothing physiologically wrong with them. The only link between these individuals was heritage and culture, and it was essentially sleep paralysis, they believed spirit attacks by a being that is similarly described to this image here in this picture. And so what would happen is they had this belief that there was a demon of sorts, a spirit beast, coming in the night and taking these individuals' souls, or ending their life. And so they would go to bed and they would just die. And a lot of them would describe like a feeling of something bad was going to happen before it happening. A lot of times it would happen it would happen at one house and then it would happen at the house next door. And doctors were baffled by it for the longest time. And the eventual consensus is that these individuals died due to their spiritual belief. And so I want you to let that soak in for a second. This is actually the inspiration behind the Freddy movies, if you don't know. And I want you to let that soak in for a bit because it just goes to show how powerful belief in and of itself is. And I've mentioned this before, but we see this a lot. Like if someone gets a false cancer diagnosis, and they're given like a time frame to live, there's been multiple incidences of someone getting that diagnosis and given a time frame and they actually die even though their cancer wasn't fatal. That's called a medical hex. Okay, so belief is extremely powerful, and I just want you to know that when we look at syndromes. So SUNS is quite interesting, and you can look that up and check it out later on. Okay. I'm gonna let Brittany in. Okay, so we'll go to the next one here. How is that thing that I just described that had no explanation, okay, and kind of a lack of understanding and a lot of weird symptoms? How is that similar to CRPS? You can say something, or you can just simmer with that, or you can type it in the chat. But I think it has some similarities to it in that there's an unknown. Okay, it's not showing up on any scans. We don't know what's happening. So I want you to know that there's some similarities there, and that's the same thing with similarities with amps and other things. Okay. Okay. Next. What does it all mean? Okay. So I need to go over stages, spreading, and remission because there's a lot of misconceptions with this. And I think it's really helpful to have those addressed. Okay. So stages of CRPS, they are not inevitable. Okay. It is not a progression that is going to happen. Okay. It is a consequence of disuse due to pain, guarding due to pain, and the alarm system going crazy. Okay. Remember, the alarm does a lot of weird things when it goes off. Think of it like a house alarm. When it goes off, it should normally just do some sirens, maybe activate the police or have ADT call you or something. This alarm system in a nervous system that's amped up in a house, what would happen is your alarm would go off and the sink would turn on and the oven and the stove would turn on and all the lights would start flashing and Welcome to the Jungle music would play on your Alexa. Um, but the alarm's not supposed to do that. And so what happens is when the alarm's going off, we start to feel these strange sensations, skin temperature changes, hair and nail changes. We get muscle spasms. We get these cold feelings, swelling, skin appearances are different. And then as time goes on of not using our muscles, not putting weight through our legs, etc., we will start to have atrophy, but it is only because we haven't been using the limb. And so the muscles and tendons start to atrophy, which ultimately could cause contractures or bone demineralization. However, as you see in this image here, this can be reversed by starting use again. So if I just mummified myself for a few weeks, I would start to shrink because I'm not moving. But if I came out of that tomb and started to move again, I could start to get my body to adapt and get used to these things. And these changes happen all the time. If you ever look up the difference between a sprinter and a marathon runner, the sprinter will be completely shredded and jacked and muscular. The marathon runner will be skinny and almost look frail. And that's because the body has adapted based on the training it's received. So it'll adapt based on the training it doesn't receive and on the training it receives. So the body is very adaptable. So that being said, the main message I want to get across is stages are often considered like inevitable in the same way that like cancer is related to stages. But CRPS is not like that. The stages are not inevitable. It's not a disease that is causing inevitable progression. It is a syndrome that is a malfunction of the nervous system. So I think that's important to differentiate to reduce the fear around, when you read about stages and you think that's where I'm headed, that's ultimately where I'm going. I don't want you to feel that way because that's what I thought too until I continued my education and learned more about this. Okay.
Chase, can I ask a question about that?
Yeah.
Since I look at these stages and they have like specific time frames, 1 to 3 months, 3 to 6 months, was this based on a study or where do these time frames even come from?
It's based on like a survey of general amounts of like general people with CRPS, and so it's like reporting, self-reporting, and so this lasting. See, this is the problem with the information, is that a lot of it is self-report because there's unknowns with it, right? That's nothing shows up on in the body when you scan it. The body looks normal when it comes to CRPS. So the point with this and the point with showing this, which this is from where did I get this from? I can't remember if it's John Hopkins or Mayo Clinic where I pulled this information here. But these are just averages of time. And simply by like the time frame of it lasting isn't like this is how long it's going to last. This is what's happening. This is inevitable. It's just like what would happen if you stopped moving for that period of time. So if I stopped moving for 3 to 6 months, eventually I'd reach, stage 3 with a normal body where it might be my muscles and tendons would start to waste away and contract. Like imagine I just strap my arm like this. Eventually I would get a contraction in my bicep because my bicep is bent, my elbow is stuck, and it's not being used. It's stiff. It's the same thing if like you sleep on your arm in a weird position and you wake up and it's stiff. Just imagine like holding your arm in that position for 3 to 6 months. And now we're not all doing that with CRPS, but we are guarding the limb that's affected, the foot, the hand, our whole body, if it's in pain. So yeah, does that answer your question?
Yeah, it does. Thanks.
Of course. Okay. So what does it all mean? Let's go move on to spreading. So spreading, yes, it does and can happen, but not for the reasons people think. The spreading is an upscaling of the hyperactivity of the alarm. It's not a symbiote. And what I mean by that is it's not Venom from Spider-Man. There is not some sort of uh, poison in your body that is spreading to different areas. And um, what is happening is the alarm is becoming more and more hyperactive, and other areas are going off. So let's say someone broke in through your back door, okay, of your house. The alarm on the back door, the motion sensor is going to go off. It's going to be hyperactive in that area. Okay. The dog's going to bark at that door. As the alarm starts to get more and more triggered through other break-ins, which could be surgeries, other injuries, then the alarm in that area is going to go off also. And so what happens is if the nervous system is hyperactive at the time of the break-in, then you might experience CRPS symptoms there. What you could also experience is the noisy neighbor effect, where the alarm, house next door is going off, and then all of a sudden your house is going off. And what we can see with that is things like mirroring, where one foot is hurting and then suddenly the other foot is hurting. This is not because there's some sort of poison or venom that has spread to the other foot. It's simply by virtue of the alarm becoming more hyperactive. Okay. So this will commonly happen at sites where there's break-ins, and sometimes it doesn't have a pattern at all. But remember, your alarm is the nervous system. The nervous system is massive. It's huge. It's complex, and so you can have that experience in other parts of your body. But no matter what, whether you experience spreading or no spreading at all with your CRPS journey, the plan to reverse or reduce these symptoms is always the same. It will always be the same. Okay? So, other examples of the alarm freaking out. I've touched on this, but I want to say color changes, swelling, itching, cramping, pulsing, throbbing, shifting, moving, sounds, lights. The alarm freaks out with these displays of attention grabbing displays, like the color change in your leg or the swelling or the cramping, that stuff. That's the alarm going haywire. Okay. It's not something that is broken with that area of your body. Like every time your ankle swells, you haven't sprained your ankle again, right? It's freaking out. And so the best thing we can do is, no matter what the alarm is doing, remember that the plan is always the same. So easier said than done, but trying to give less attention to the symptoms and what's happening with the alarm, and just saying, yep, there goes that stubborn alarm freaking out again. What we need to do is we need to follow the plan, which is always the same, and that is calm down the nervous system. Okay, so you guys see this all the time in the groups. You see people talking about their nervous system being in fight or flight, being stuck there. That happens to a lot of people, not just people with CRPS. That happens to people with toxic jobs. That happens to people in toxic relationships. That happens to people trying to maintain a 5-person family all by themselves. You get into what is called a overly active fight or flight nervous system, and when you're in that fight or flight, your heart beats fast. Your breath is like your pupils might expand. Your gut becomes inactive, gastroparesis. Have we heard that term before? You get blood rushing to your skeletal muscles and away from the brain, making it hard to think, brain fog, swelling, etc. You get hormone changes, anxious changes, and you get fatigued, no energy, because your stress response is hyperactive. The alarm is going crazy. So we need to move more towards the parasympathetic, the rest and digest aspect of our nervous system. Slow our breathing. We could do something like meditation, NSDR. We could do yoga. We slow down our heart rate. Our gut will become more active. We'll get more blood flow to the gut, the lungs, and the brain, helping with brain fog, helping with gastroparesis, and our energy will come back. What are some activities that could calm our nervous system? Spending time with friends, petting our dog, drinking our favorite tea on our back porch on a Sunday morning, painting, getting out in the garden. All of these things could calm the nervous system down. And in turn, we're calming down the alarm, reprogramming the alarm. In order to fully calm the alarm system, the system needs information. So today, my dad forgot the alarm was on and he walked out the front door. And we got a call from the alarm service asking what was going on. I told them, hey, it's okay. My dad activated the alarm. He didn't know the code to shut it off. And they said, okay, no problem. We'll turn it off. And he hung up, right? In our body is calling and it's saying, hey, what's going on? We need information. We've been in pain for a long time, what happens is the map of our brain gets blurred. So it looks like this map here that has black on it. When it gets blurred, there's no information, and that can amplify our pain experience. That can make the area of our body that's affected have very bad time tolerating sensory input, like things that shouldn't hurt. So what we need to do is we need to provide that area of the body with information in a gentle and calm way to start to tone down that alarm and update the map of the brain. So as you can see, as we start to do something like desensitization, which I put out a video about that a few days ago, so check it out if you haven't seen it. As we start to do that, our map updates until it's all clear again. And this is our brain updating. And our brain right here is a slice of our brain, the primary motor cortex. Our brain has a built-in map of these areas of our body. And if you imagine yourself in pain, imagine some of these areas of our body not being very visible, being blurry. So the only way to start to calm that particular aspect of the nervous system is to update information for the brain to start to relax the alarm again. Okay. So yeah, check out that desensitization video if you haven't seen it. I think it's good. And if you're sitting here saying, I've had desensitization before and it was awful, I promise you it's different because a lot of physical therapists don't know how to explain desensitization. They don't even know what it is. Some desensitization is not something that should make you cry, scream, withdraw. It should be something gentle and safe to not trigger the alarm. So it's a slow process, but it's helpful. It's how I found my way out, one aspect of it, and it's how I show my clients to do it too. Okay, it's been a lot. I'm going to take a breath. So the 4 R's to calming CRPS. We're going to relearn and forget false medical messaging. So things that we've been told about our bodies being broken, shattered, having the back of a 70-year-old when you're 22, which is what I was told. Having the worst herniation that the doctor who does 100 surgeries a year has ever seen, which is what I was told. We need to forget some of those things, relearn some of those things, and know that our spine is very resilient. If you want proof of this, watch the movie Bleed for This with Miles Teller. Fantastic true story about a boxer. That will show you how resilient the spine is. Another thing we need to do, the second R of calming CRPS, is reduce negative self-talk and consumption of negative info. So, like I've said in all the other Zooms, guard your mind just like you guard your body. You'll be surprised what will happen when you start to lean into hope and away from fear. The next thing you need to do to calm CRPS is reimagine your future. What could life be like if you weren't hurting? And what can you do right now for your life that is enjoyable, even while you're hurting? Sometimes we wait for pain to be over before we continue to live our life. That's okay for a sprained ankle. That's not okay for CRPS, because then our life will just be in limbo forever. Life is moving. Time is moving on. We need to live. We need to thrive, not just survive. So as much as you can, lean towards a future that is exciting for you, and see what you can do now, even while in pain, in a paced and tolerable way. And then through that, you hit the 4th R of calming CRPS, which is reclaiming your life. I thought my life was over when I was diagnosed with CRPS. And I was told by doctors who know nothing about the condition that I'd never be able to do certain things again, and I do all of them today. So, as I said in the last Zoom, we can accept that doctors don't know much about CRPS. So let's not accept the limitations they place on us. Okay. The body is resilient and amazing. And I want you to tell yourself that. Okay. So, remission, the last one of this stage of spreading in remission. The problem with remission, it is extremely helpful term for insurance, disability, and legal battles because CRPS is so painful, it's debilitating. I couldn't do anything but lay on a couch and open Yu-Gi-Oh cards and watch Cops. I watched 1,000 episodes of Cops, I swear. I can't even watch Cops now. It's just too much, or I've already seen it. But anyways, it's debilitating. So it is helpful to have this term in the sense of it'll help us with disability payments or insurance claims, things like that. Those are things people need. I'm not saying that they don't. I think definitely we do, and I think it's helpful in that way. But the term itself is harmful for our mental state. CRPS is not cancer, but things like stages, remission, and spreading, those sound like cancer. Okay. And cancer's scary. And so I want you to be mindful of that when you hear the term or the phrase remission. Just remember that it can be a tricky phrase. Let's put it that way. This might be a wild thing to see on my slide and a hard thing to hear, and it was for me too. But most people do recover from CRPS. About 85% of people with CRPS will experience a reduction in pain and other symptoms within the first 2 years. Some people make a full recovery in a few months, and some people will have ongoing symptoms, minor to severe, and a small number of people will experience chronic pain. And then only about 10% of people will experience a recurrence of CRPS for the reasons I mentioned previously of the alarm becoming hyperactive again. That's why we will see recurrences or relapses when someone has extreme stress at college, putting a lot of pressure on themselves, or when something like COVID happens, or when we have a death in the family, or a divorce, or another injury of sorts. Some people, 1 in 10, will experience that. If all the pieces of the puzzle are in place for it to happen, it will happen. The good news is, if you've gotten into remission once and recovered from CRPS once, you're much more likely and much more adept, especially if you've been taught properly, to do it again. So for me personally, I've been out of pain for 7 years. I've tattooed my arms, my chest, my nipples. I've lasered them off. Sorry, didn't laser my nipples off, but lasered the tattoo off. I've broken my collarbone. I've had all kinds of other injuries, and there's been no recurrence. If it did recur, I would do the same thing that I did the first time, but I'd do it better because I've learned a lot of things and I help people with this all the time. So, next. Questions. I've just talked a lot. I'm going to stop the share so I can come talk to you guys in the Zoom itself. What are questions? Oh, let me go into the questions just in general. But you go ahead and talk to me about questions you might have right now. Go ahead.
Okay, I'll stop and break the silence, or start and break the silence.
Sure.
So I saw my orthopedic surgeon who fixed my knee, which was my last surgery. It was my 6-month follow-up. And I had told him about you, for one, and told him that I got back into physical therapy just for the CRPS. Everything he did has healed. I'm pretty much done with him, you know. He did his job and now I have to do mine. And so when I started the physical therapy, a few things happened. I started getting the sharp pains in my head, pressure. I have vision change, ear pain without an ear infection, all on the left side. And then my arms started burning. It keeps happening the day of PT, and then today is the day after PT. So by tonight, my alarm system will be calming down. And we just laughed because I asked him, does that make sense to you? And he said, no. And I said, well, I guess the nervous system is hard to make sense of, for one.
Yes.
And for two, what was the other thing? Gosh, come on, brain, don't do this. No, it just, there it went.
It's all right.
As quick as it came.
Let me
But
start.
we basically were discussing how the nervous system is, it's not explainable. I just know it's all connected. So I feel like it's responding. Every action deserves a reaction. But one thing I have to share, because I was amazed, and it gave me another big bag of hope. And they come in sacks. Like I get to open them up and then go through them. I went 5 days without the bone pain since I've started PT. And the day it came back was Christmas Eve or Christmas Day. And the only other thing that was different was we had a storm here in Colorado and I wasn't walking. I was not doing my 20-minute walks, 20 minutes a day of movement. And I think that's why the bone pain came back. I have a treadmill sitting right here in front of me. I didn't get on it. So I'm going to hold myself more accountable because I've committed to the physical therapy for one. I'm the only one that could get up and make this happen. And then I'm the one that's stuck in the body if I don't get up and do something. So I'm going to hush now and hear what you have to say.
Well, you're absolutely right. And as I mentioned in the Zoom, the alarm is going to do weird things. The less attention we pay to those false alarms, the better. That's hard sometimes because we're in pain, of course. But it's going to be much better than freaking out about, okay, I just did PT, which is something new, and suddenly this feels weird in my head or my jaw hurts. Yes, you've done something new that the body wasn't used to. And of course, the alarm is going off. If I go out tomorrow and I run 13 miles, I haven't ran in a while, I'm going to have an alarm reaction. And anybody with CRPS or without, if they suddenly ran 13 miles, would have an alarm reaction because they're not used to that. But someone who trains that way would not. And so with your PT, what your PT might be right now, even though it's simple activities and stuff, to your body, that feels like 13 miles. And so we're having that kind of flare reaction. But you have the right attitude about it. Eventually it's going to calm down and then you continue again. If you go to PT and you have a flare reaction and it lasts for, a bunch of days, it might be a good idea to communicate with your PT. Or if you're working with me in pain coaching and you have a flare, I want you to communicate with me so that we can scale back or pace these activities in a way at first that is safe and good. And then eventually it'll be easier for you to do it. So an example, I can't go run 13 miles right now, but if I go out today and I run a mile, and then I do that for a week straight, and then next week I run 2.5 miles and a week straight, and then I just add and add and add, eventually 13 miles will be a piece of cake. Okay. CRPS, sometimes small things are 13 miles, and that'll set off the alarm.
Well, I did also have the stress of the holidays. It was Christmas Eve, Christmas Day. That alone is really hard for me.
Yes.
Just the holidays. It wasn't how I'm used to, and I took that hard. So that was a huge factor in that week. So it all makes sense.
Yep. So, hold on, I'm going to let someone in here. Yeah, no, you're exactly right, Holly. Those are patterns that we want to identify. So for example, on June 20th, every year, I feel awful, no matter what. And at 2:20 p.m. on June 20th of 2011, my mom died. And ever since then, I've felt awful that day. I just know it's coming. And so I want you to look for significant dates, for significant times of the year, etc., that might make things hard for you. And that will show you the illusion of the body crumbling, when a lot of times there's an emotional, mental component as well. The mind and body are two sides of the same coin. If you move one, the other moves, always, often. So if you get angry, your face, your jaw clenches, your fist ball. If you get embarrassed, you turn red. If you have a intuition about the future, you get a gut feeling. The body and mind are intertwined as one. Medicine has too much of a habit of making it only the body, zooming in on only the body. But you're a full system, a nervous system. Okay, let me look at some of the other questions that we have here. Okay, so give me 1 second.
Hey Chase, can you answer my question about the movie you told me to watch last night? Because
Yeah, where's it at?
as you know, I'm dealing with failed back surgery syndrome and the CRPS. And before my fusion, I had no back pain. They just assumed that my leg pain was L5. Um, but then I watched the movie you told me to watch last night, and I'm like, well, he never got the fusion. So does that put me kind of in a different category?
No,
With
because you said yourself the fusion failed, right?
it failed, but I'm thinking I watched the movie and I'm like, that's cool. He said no to the fusion, which I did for years because I know about adjacent segment. I went ahead and got the fusion. I didn't fuse. I've got adjacent segment now, problems with SI joints. So is there a point where, okay, yeah, there is structural damage that is going to cause you. See, I can envision fighting the CRPS pain.
Mhm.
It's lower back pain. And like I'm the one that said the accordion, the broken
I
accordion.
know.
It that's a whole different mind screw for me. I don't know.
Yeah. Yeah, and that mind screw is something we need to unscrew. And so that's why I often talk to you about the wording that you use when you describe your spine. Um, he was in a significant car accident. He messed up his neck, and then he went back to being a professional boxer. True story. And you know, getting fixated, if he just got fixated on the structure or the individual position of what segment was doing what, etc., if he just got fixated and locked into that feeling, there's no way he would have ever gone back to boxing. And so what I say is the alarm is doing weird things. You're feeling pain in the back, in the leg, in the foot, etc. Again, reducing our attention to those things, putting our attention on the things we can do, like going and playing basketball with our daughter, walking on the treadmill, going to the beach, etc. That is what's going to be the remedy. Focusing, just like I said, the medical field focuses too much on structure. If you continue to focus only on structure, you miss the big picture. The big picture is that we're not a back or a leg or a foot. You're a human. And so the path to healing is to not focus so much on structure. You've gone down that path, and that path led to break-ins and a hyperactive alarm. The path now is a zoom out path, and the body is hyper resilient. Look at an amputee. They have structural damage that is permanent forever. Their leg is gone, but a lot of them have no pain. And they literally have structural damage, as in like the bone is cut, the nerves are cut, the veins are cut. But
Well,
a lot, most of
like
them have no pain.
I just see and feel movement constantly, and all I'm
Hmm.
thinking is, when are those screws going to come loose? When is that cage going to fail? And I know that we were going to address this after the CRPS because the CRPS is right now my biggest disability. But yeah, this is something that when I watched the movie, I was like, but I got the fusion. He didn't. He healed naturally. And I
Hmm.
actually said yes to the fusion, which created really more structural damage. It's hard to get my mindset out of that. I guess that's
It
something we
is.
work on later.
Yeah, and there's books that I'm going to recommend to you that discuss that when we go through the pain coaching. So yeah, this isn't an easy thing. I mean, I for 6 years after I was out of pain, I didn't squat because I was worried that my back was going to get messed up because it was structurally damaged. I didn't deadlift for the same reason, and because doctors had told me, your back is messed up and fragile, don't do that. And so it's not an easy journey to get out of that mindset. And I'm going to show you something. I'm looking at something on my phone. In order to prove that to myself, to prove to myself that my back was strong after 6 years of not squatting, I decided in a single year I was going to do 10,000 squats, 10 sets of 10 every 4 to 11 days. And I kept track of that. And I did that
Okay.
for an entire year to prove to myself that my back was strong. Did I have pain sometimes? Yes. Did I worry sometimes that I screwed something up? Yes. That's normal. Those are normal feelings, understandable feelings. This isn't going to be something where I just tell you and you're like, all right, cool beans. It's going to be a day, almost a daily thing where you're going to message me and there's going to be reassurance needed, and that's all part of what I do as a pain coach.
Okay, and my other question, I'm sure, is a quick one. We talk about the alarm system, so I'm in a really bad flare last night, which is kind of disappointing because I've been doing so good, as you know, for the last couple of weeks. Um, it's in my feet and my legs, it's my CRPS, and it's my failed back surgery, stupid pain. My husband came in and kissed me on the cheek. This happens often. He's got some pokey whiskers, and it exasperated the pain I was feeling in my feet and my legs. So even though that's a different part of the body that I felt the whiskers on, that's still the same alarm system type of thing, even though it's in a different part of the body that you're getting. Do you know what I mean?
Yeah, 100%.
Okay. Well, I didn't know if that was the thing. Like people say, like with me, like if I'm in a flare and a feather touches my leg, it exasperates pain. But I would never think that something touching my face would exasperate the pain in my feet and legs.
I mean, it's a whole system, just like the house. The alarm's going to go off whether you go in the back door or the window. If the alarm didn't go off when that happened, it wouldn't be the greatest alarm system, right? I'd break into the window every time. So yeah, if you're in a flare, something like that might cause the alarm system go off. But once your flare has calmed down, he could probably kiss you on the cheek, the nose, and the eyeball, and you'd probably do okay.
Or he could shave.
That's true too. But for some of the women in here, if their husband shaved, that would trigger their alarm. Just seeing his face without facial hair, that could be bad. So anyways, little joke, but I want to
Jace,
show
can
you.
I jump in and share with Kelly what you challenged me about as I was going into my ketamine appointment regarding pain? Because
Absolutely.
I think it's applicable what you were speaking about with the lifting. You felt pain. It wasn't the pain, right? It was the pain of a muscle working that hasn't worked for a little while. Kelly, I've been doing ketamine treatments, and that, oh my gosh, that plus finding Chase at the right time, I'm on no pain meds. I'm doing great. And
Nice.
I was heading into a therapy of a ketamine appointment, and I was like, oh my gosh, what am I doing? I'm not maximizing this at all. Let me ask Chase what he thinks about me moving my leg in ways that I haven't been, but doing that and then letting the ketamine do its thing, right? And what Chase said to me, and I'm sorry I never got back to you, Chase, because I was
Okay.
like, you blew my mind with it. Chase challenged me to think about the pain. Think about, where are you feeling it? What is the pain? Like, really drill down. And number one, I'm autistic. It's better if I don't. I have a high pain tolerance because I can stand a lot if I don't acknowledge that I'm hurting. So that's number one. I was like, no, sorry, Chase, no. But then I thought about it, and he was right. He was right, because when I got in there and was like, what is this pain? There wasn't actual pain. There was the expectation of pain.
Yeah.
The things I was doing truly weren't actually causing pain. And then after the appointment, oh my gosh, I have so much more freedom and so much less pain, and well, so much less CRPS pain, because the pain I've had is that good pain, that pain of muscles working that haven't worked for a while.
That's
And
awesome. I mean, it's because of Chase that I've hit the gym several times in the last couple of weeks, because I got into a situation where I just stopped doing things because I had a spinal cord stimulator put in. It quadrupled my CRPS pain. So they had me turn it off and we're waiting to take it out. But it got to the point where I was afraid to move. So because of some of his thoughts and methods, I've been getting out on the beach, and I went back to doing bird rescues and going to the gym and stuff like that. And I think the same as you too. I try to tell myself that I literally try to tell myself it's not pain. I've had the ketamine. I've had one ketamine infusion, didn't really do much. But I think my problem is lying in, Chase was trying to explain to me, you're going to feel really great but then you're going to go down again. Then you're going to feel really great again for longer, but then you're going to go down again for shorter. And I think like right now, because I'm in such a bad pain flare, my problem is I start to freak out. I start to go, oh no, not this again. I was doing so good. What happened? And I feel disappointed. I think that's
Mhm.
So
one of
thank yourself. You can reassure yourself, hey, thank you for looking out for me, nerves. I appreciate that. You know what? We're actually okay right now. You can relax.
the thing.
You can back out loud. And I don't care if it looks stupid or whatever, because what we need to do, what Chase has talked about, is reassure those nerves that they are safe. Reassure
Mhm.
that system it is safe. We don't need to alarm. And for me, give it some acknowledgement, man. It's working hard. It's doing its best. We
Yep.
just don't need it to do that thing right now. Hey,
Ab-
thank you. Thank you for looking out for me. I appreciate it. You know what? We're okay right now. You can relax, nerves. And
Yep.
that honestly, that plus the ketamine, it's just like wiping the field clean so a new crop can come up.
I would like to have
And
So,
a series of ketamine.
yeah.
My doctor won't do a series. She only did
Mm.
one. And I'm like, but
so
I'm so happy to hear that that works for
six
you.
six sessions to see improvement.
Yeah, I
Six
know.
sessions. And I know it was doing work up to that I just didn't see. So
Right.
I think you're on the right track. I think you need to give it some more tries. Let it build up. Let it build on
Kelly,
itself.
Kelly's on her way, and I want you to know, Kelly, like all these questions that you have, it's normal for me. I've seen you and your experience 100 times. So like when people come to me with these questions, you've been through unique experiences. You've had unique surgeries and things like that. But these fears and worries and things like that, these are regular for me as a complex pain therapist. I see these questions and worries all the time. That's why I have things queued up like this. I'll show it right now, which is the road to recovery. We often think that we're gonna have this linear pattern, but it doesn't look like that. What it actually looks like is the one here. You can see this, correct?
Yeah.
So that's more what the road to recovery looks like. And that was the experience for me. And during that time, I didn't have anyone telling me what to do or anything. I had no advice. And I was that's why I understand you guys, is because I was fearful as all heck, and it's going to be a process, Kelly, and that's why we're working together. It's going to be a step-by-step thing, but eventually you will get there. And Kinsey, you're absolutely right. Sometimes what happens, I like to use this analogy. So hold on, give me a second. I wish I had my
I
laundry
also
in here.
think if it's like, if, I've been an athlete my whole life, we
Uh-huh.
we follow that straight arrow. And
Yep.
so this is a new concept, this all over the place thing. And I've got to get my mind to appreciate that.
Yes, absolutely. Hold on, I'm setting something up. Okay, so imagine you see this chair. Can you guys? Someone say yes. Okay.
Yes.
No, okay.
With the
So
jacket on it.
yes, so you see that chair. So imagine it's
Yeah.
the middle of the night and you wake up and you look in the corner and you see just this shadowy thing on the chair. That's scary, isn't it? That's my sleep paralysis demon, okay? And I freak out and I go, "Oh my God, what is that?" But then as my eyes adjust and I look at it and I observe it and I watch it, the fear goes down and I'm like, "Wait a minute. That's just one of my sweatshirts. That's just my laundry pile." And then I calm down. And so, Kinsey, that's why I told you to look at the pain, because what happens is we get so used to just avoiding the experience because of the traumatic things we've been through. And we withdraw and we even separate from the pain. We dissociate. We want people to cut off our leg. We want to just get rid of our bad leg or our bad back or our bad knee or our bad shoulder. When we do that, that maintains its status as sleep paralysis demon. But if you look at it and you examine it and you say, what actually am I feeling? Where does my pain start? Where does it stop? Is it sharp? Is it cold? Is it hot? Can I change it? Eventually you start to see, okay, yes, when I move this way, there's some discomfort, but if I move slowly, it's not quite as bad. Or if I twist this way, it's not quite so bad. Or if I talk to myself and say, "Hey, I'm safe. You're going to be fine. It's not quite so bad. And so, what I would encourage all of you to do as an exercise, and I do this with my coaching clients as well, explore your pain a little bit, even when you're in a flare. Look and see, like, okay, where does it start and stop? What does it feel like? Can I change it? If I think a certain thing, does it help? Um, Make it so the demon is just a pile of laundry on a chair and not the sleep paralysis demon. Okay. And
Can
that's
I come
that's a
in?
constant battle. Yeah, real quick, Matt.
Yeah. Just speaking with you for the last couple of sessions has increased my self-confidence, and I just want to let you know that you remember us talking about me wanting to go around the block.
Yeah.
I did 2.5 miles yesterday.
Oh my gosh. That's fantastic.
Yeah, and on my Fitbit, of course, but still, it's 2.5 miles and walking, and
Yeah.
probably 3/4 of a mile around the block. And I just want to let you know, I now see the CRPS as not just something that's happening, but it's happening in the same place over and over and over, and I don't pay attention to it anymore because I know even though the pain's there, 45 minutes, an hour later, it's going to be somewhere else,
Yeah.
and I just got to keep on rolling forward.
Exactly. And that's that. And Matt, I'm so happy to hear that.
Yeah.
I want you guys to know that Matt and I have really just talked so far. We're actually, our first true session is going to be tomorrow. And so, all I'm doing is giving permission. Okay. You can
Yeah.
start to live again.
Exactly.
And that's what I had to do. I realized that no matter what's going on with my back structurally or not, my choice is I'm not going to get another surgery. That's for sure. I'm not going to listen to more doctors. That's for sure. My choice is to live or not to live. I choose to live. And so, anyways, thank you, Holly, Kinsey, and Matt, for all of that input. That's a valuable discussion. I think people watching this on YouTube and the replay are going to be really happy. I want to start to go through some of the chat questions. So let me go through this real quick, okay, guys? Okay. Can the weird gait in my legs or walking be caused from the CRPS or something else or stress? They want to do an EMG, but that may trigger more CRPS flares for me. Thank you for the help. So, Jen, I would have to know more about your medical background. We don't have to get into that, but I can answer generally. Um, the weird gait could be from not using it so much. The weird gait could also be from just general activity of the alarm system, so nervous system symptoms. That weird gait is seen in something that's often co-diagnosed with CRPS. That's FND. But FND is a really interesting thing because I see that's my second specialty is FND, CRPS and FND. I see FND all the time where someone will have weird gait in their legs one week and then the next week they'll be walking fine or in a wheelchair and then the next week completely fine and recovered. I've had people where I've explained that FND has a relationship to emotional stress and emotional regulation, and them just accepting the fact that that's the case sometimes cures the symptoms. Most people would take a little longer, but Jen, the weird gait in your legs could be caused from something like CRPS or stress, but it's not. It's not CRPS as a venomous disease, an evil disease. It's CRPS as a hyperactive nervous system. All that a name like CRPS and things is doing is explaining what's happening. It's complex. It's in a region of the body, and it's painful. That's it. They're just explaining it. Arthritis is the same thing. They're literally just explaining something they've observed in the body. Arth means joint. Itis means inflammation. Your joint is inflamed. That's literally just them explaining what's happening in the body. All of us have arthritis. We're all having inflammation from time to time, but it's not causative of pain. And so I want you to know my camera is going wild. I want you to know that it could be related to the CRPS or stress. But if they need to do a test to rule out something else, then that's okay. But I just want you to know that there could be a relationship there for that.
Thank you so much.
Absolutely. Holly, I've had a few rotator cuff repair surgeries and there was pain after surgery and that pain was relieved. If the actual structure was not causing the pain, what was the pain from? Pause for 1 second. Give me a second. I don't know your particular situation, Holly, but this book, Surgery, The Ultimate Placebo, is something that I recommend all of you read. There is a bunch of research and this is written by an orthopedic surgeon, so the person doing the surgeries. People will go in for a rotator cuff surgery. It'll be a study. Half the group will get the actual surgery. Half the groups will get a fake surgery. And what I mean by that is they put you in the same operating room, they put you to sleep, they make fake cuts in the same spot they would make on the actual surgery. Guess which group of the two does better?
The
Trick
one that was
question.
just cut.
The trick question, both groups have equal outcomes. Okay, this is true for back surgery too. Sometimes with back surgery, people will have better outcomes, like on a discectomy, for example. If the surgeon shows them that they've removed something, the person will have a better outcome than when the surgeon doesn't show them. It's the same surgery, but the visual aid provided better outcomes. The wording of what happens when you go into surgery, what to expect, etc., affects your outcome. So read this book if you have concerns or thoughts about structures still. And just know that there's a number of reasons that you might feel better after rotator cuff surgery. I would also call into question what was happening in my life around the time I had shoulder pain. When I got better from CRPS, I eventually had a bout of ulcerative colitis, which doctors told me was forever. Turns out, when I started that bout of ulcerative colitis, my sister had moved in with me, and she was acting a fool, and it was a lot of stress on me, and I started having blood in my stool. And then when I called the doctor to explain them, the nurse goes, "Oh my gosh, that's a sign of cancer." And guess how I felt for a long time? Bad. But I was given a pill by the doctor. It's sulfasalazine. He said, "Take it forever. Good luck." I don't take that medicine anymore. I have no symptoms. And it's by addressing these things that set off my alarm, the stress stuff. It's by getting a better relationship with my sister that doesn't involve me being a pseudo father. Okay.
Chase, can I say something?
Yes.
Your recommendation on the book, Surgery is Placebo. As I told you, I was a smoker when I was told that I needed a fusion. I didn't want it. I knew the success rates for smokers. I had a surgeon who said, "Oh, but don't worry, I'll use the special revision protein that I use on smokers, and you'll fuse just fine." And it was, I don't know, maybe my 2-week appointment after the surgery. I said, "Thank God you use that, revision protein, because it's great. I'm a non-smoker now, but man, I wouldn't have fused." And his head just went down to the floor, and I was like, "You forgot to use it?" And he was like, "Yeah, but you'll be fine." I wonder what would have happened, not only to my back pain that didn't even come around until after the surgery, but to everything about me, if he had never revealed that he screwed up and used the wrong fusing agent. Do you know what I mean?
Exactly.
I wonder if that fed into me psychologically that,
Exactly.
Oh my God, I'm never going to get better.
Exactly. That's exactly. Yep. If you would have just said, "Yeah, thank goodness," and left the room, probably would have been different. Research would suggest it would have been different. He was honest. That's a good thing to be. But I want you to know that the placebo and the nocebo, the opposite of placebo, is a very powerful effect. Okay, let's see. Structure automatically doesn't. Yes, Allison, you're exactly right. Your interpretation is correct. Structure is one factor. It's a very small factor, and a lot of times has no significance whatsoever. That's why when I did my presentation on neuroplasticity and re-explaining pain, I said, structures. Why am I whispering? Because they're not that significant. Okay. I lived out exactly what my doctor told me would happen in stages over a number of years. It wasn't until I started to make small step forwards and fighting back, then pain decreased and I dismissed my doctor. Nice. Yeah, that's exactly right, Amy. You live out what you're expected to live out. Like if a doctor tells you you're going to die of cancer in 3 months, sometimes you die, and for some people the cancer wasn't even the correct diagnosis. This has happened, and that I think I talk about that in my third Zoom, so you can check out that story. Actually, no, it's in the video called "Watch Your Language." It's about placebo and nocebo effect. So please watch that video on my YouTube if you haven't. I think it's pretty powerful. Watch your language. Message to healthcare providers. That's the video. Okay. Oh, talked about that. That's awesome. Denise said her mantra is for this new year, thrive in 25. I love it. I love it. We'll talk more about the movie eventually, Kelly. I see that question. I don't like the word because it means it could come back. Yeah, that's why I don't like the word remission either. I say that I have achieved recovery. In the groups, I still say remission/recovery because sometimes it's hard for people to see recover in association with CRPS. My hope is someday that that can change. But it's okay right now. Everyone's at a different spot in what they're able to accept or digest, and so that's no problem. If I would have came to myself, let me put it this way for you guys. If I would have came to myself 10 years ago with some of the stuff that I'm saying now, I probably would have punched myself directly in the face. Okay, because I was stubborn and in pain and angry. And so I don't blame people for being angry or upset because they've been let down a lot. And so my goal is to help people when they're ready. And those that feel angry, I greet them with as much kindness as I possibly can, because they're just me. They're just me 10 years ago. Okay, what else? My son is 6 years in. Would it be beneficial in trying PT to again be beneficial? Yeah, possibly yes. And if you go to try a physical therapist and you want them to talk with me, like if they don't know what CRPS is, Sherry and Cody, that's fine. They can reach out to me. Okay. You can also look into the pain coaching that's on my website. So go to thewindowpain.com, click get scheduled, and we can do a 30-minute consult and I can talk to you about pain coaching. That is a coaching relationship, but I use my experience with CRPS myself and my background as a doctor of physical therapy to guide you to a more fulfilling life with less pain. Lenora hated being seen as not a whole person and as each issue has come up. Yeah. How many doctors ask you about life stresses? How many doctors ask you about trauma? Not many. Many doctors don't even get a lecture on that through school. And so, that's hard for doctors to do. Let's give them some credit. They only got 10 or 15 minutes with you. But that's why I chose the profession of physical therapy because I get an hour with my patient. I chose a profession that isn't the best from a pay standpoint, but it was the one I knew I could help people in. And so that's where I am. Okay. Is there a way to reverse the effects of past trauma, which is heightening the alarm? I heard the body holds on to trauma, hence causing the nervous system regulation issues. The body holds on to the trauma. We will continue to accrue body pain. So it holds on to it, but we can put it down. Okay, so if you feel like you're stuck in a past experience, which I've seen a lot of people that are stuck at certain ages when a traumatic event happened. So for me, for example, I was in the hospital for 8 months when I was 3 years old. That makes it so anytime I get a shot, I have to inform the nurse that I'll pass out and they have to lay me down or hold me up. When I got my flu shot this year, I laid on the floor of the CVS and they gave it to me and I passed out and then I woke up. That is a trauma response. Okay. I can handle needles. I've got all this tattooed. Okay. But shots for some reason, because of my memories as a 3-year-old, make me pass out. Yes, your body can relearn and find ways to process that in a more healthy way. And one of the ways I teach people to do that is if you have a certain time period of your life when you had something traumatic happened and you didn't feel safe and no one was there to help you. So like for me, 3 years old. I took a picture of myself at 3 years old. I put it on the mirror in my restroom and I would talk to it every morning. And I would tell myself, that 3-year-old, that, hey, I'm here for you now. You're safe. It's going to be okay. And you would be, so I'm getting emotional right now talking about it, but you would be surprised what that'll do for you. So go through the ages, go through and talk about it. And then what is this? People suggested books. Yep, The Body Keeps the Score is a great book. That's an awesome one for trauma. Waking the Tiger by Peter Levine, another awesome one for trauma. Those are all linked on my website. You can go to the books section. You can find that. Listening to the book, depending on your way of getting input, is sometimes better. Some of these books are read by great performers or the author themselves. So you really get the emotion behind the words. I personally like listening to the book. But yeah, The Body Keeps the Score would be a great book to read. That book originally was written for providers, but it took off as something that patients loved. So fun fact about that book. Bessel is amazing.
Chase, I also wanted to chime in that there's probably quite a few of us that have the whole overachiever syndrome, and we beat this and we beat that, and we've triumphed, and we've always come out on top.
Yeah.
I don't know about others of you, but this has been different for me. So what I have to work on is not constantly feeling like a failure. If I have a good week and then I have a crappy week, I feel like I've failed because everything else, my cancers, my knee surgeries, everything else I've beat, I've come out on top. And this is a different avenue. So there's that constant voice going, you're failing, you're failing. Everything else, you've snapped your fingers and you've been over it. So I think there's
Yeah.
that's something that we all need to think about, is that we're not failures, as long as we're putting our feet on the ground every day and trying to do something. And I still struggle with that.
Yeah, no, I think that's a common theme with people who have CRPS. I'm going to put this in the chat. I've done this before, and I'll put it on the screen. I'm going to try to remember to put it on the screen. And we're going to talk about this in the next Zoom, this specifically. But this is the common personality traits of someone who might experience a chronic illness or CRPS. And I see this very often. So it's in the chat if you want to take a look at that. I will put it in the Zoom when I edit this. But yeah, so yeah, there's definitely a correlation there, and there's definitely, a reframing of how we view certain things. I've been responding so well with PT. Sheila, I love that. Okay, let's see. Is there any relationship with CRPS and stomach issues? Yeah, Cheryl, I think you probably saw that in the presentation. A hyperactive or overly fight or flight nervous system leads to difficulties with digestion because it's fight or flight versus rest or digest. So if you're in fight or flight, you cannot activate as easily rest or digest. You don't want to stop to pee yourself if you're getting chased by a lion. Okay. Here, I'll try to help you. I think you're trying to unmute. I don't know if it worked.
Yeah, no, I mean, I've told you about the test results I'm waiting for, which I think has had a little bit of pressure on me. But I'm trying to override it. As I told you, and I put in the group the other day, that I've been trying to be positive and push myself and do more things, and that's helping. But I'm thinking that maybe, because of my initial CRPS, how that's affected all the other things. And you covered that already with that other thing. But I don't know what I'm trying to say, really. It's hard.
Yeah.
It's hard.
So
Go on.
There's two books, and one I've already recommended to you.
Yeah.
Why Zebras Don't Get Ulcers.
I read some of that. That was pretty. In fact, no, I read all of that. That was really good.
So Why Zebras Don't Get Ulcers.
Yeah.
Look that up, guys. And then another one is When the Body Says No by Dr. Gabor Mate.
Yeah.
So yeah, I check those out. When I read both of
Yeah, I'll do that.
When I read both of those, it changed my perspective on the ulcerative colitis thing.
Yeah, I think I need to reread them again, actually, because it did help when I read it, but it was a couple of weeks ago. So, and a lot of things have happened since then.
Yeah.
Trying to stay positive, and to be honest, they would have got in touch with me if there was something really, really bad going on, I think, by now, and they haven't. So I'm positive that it's nothing too serious, and it's something that I can beat in another way.
Yes, I'll tell you one fun fact. My father, he has back pain occasionally. He had a really, really hard bout with back pain and diverticulitis a couple years ago, and it just so happened to coincide with the time when he was attempting to sell his dental practice. As soon as I said, Dad, when the dental practice is sold, you're going to feel much better. He sold it, symptoms gone.
Oh, there you go.
So remember, chasing structure is missing the big picture. Okay.
Right.
He had partners that he was selling the practice with that were very difficult. And once that was over, playing golf. lifting weights at the gym. He's 74 years old. So
Gotcha.
let me go back to the presentation. We've gone through some questions here. So I'm going to go back to it real quick. Where are we? Here we go. Can everyone see it?
Yeah.
Okay. Okay, so clicking through. Sorry for the fast clicking. Okay, questions. Okay, so I need to form the plan for the next couple weeks. Okay, so here it is. As we've started to discuss, and this is on purpose, Zoom number 5 is going to be in relationships to trauma, emotion, and CRPS, the connection between those things. Okay. That's going to be an interesting one. I think it's going to be an emotional one, but that is good. Feelings are meant to be felt. So if you have traumatic experiences in your life and you're trying to go back and rewrite that experience, I would try my photograph exercise where you put the photograph on the mirror. Another thing you can do is my timeline exercise where you do one timeline of all your physical ailments. This includes physical injury, physical pain, intestinal things, etc. And then draw another timeline underneath it of all your life events. And I think you'll be pretty fascinated by what you see. That Zoom, trauma, emotion, and CRPS, is going to take place 2 weeks from today on the 18th at 2 p.m. U.S. Central Time. Okay. On 2 weeks from that day is going to be Zoom number 6, and that is going to be the launch party. So we've had a lot of fun in here with you guys. A lot of you guys are regular attendees, and I really appreciate that. What I'd like to do is I'd like to have a Zoom that day where I talk a little bit about CRPS some more, but then overall we just hang out, celebrate that we're coming this far. A lot of you are doing great, wonderful, amazing things. And so we're going to use that as a fun little time to launch my program, which I'm going to talk about now on the February the 1st. Okay. So program overview. If you saw my episode yesterday with Charles, when I was going through CRPS, I had no money. Okay. I had no avenue to get help. And a lot of the programs that are out there for CRPS are $12,000, $15,000, $50,000, $100,000.
Yeah.
And nobody can afford that. Well, some people can, but I can't. And so my intention when I decided I'm coming back to help people was to find a way to make something affordable for those that were in different situations budget-wise. So obviously there's free resources on YouTube. Those resources are great, but they're a little bit scattered. They're not really organized. There's a lot of dialogue, a lot of stuff to sift through. So I've developed and am developing a self-guided 8-module, so 8-week program that includes education, like I've done in these Zooms. It includes worksheets that are based in cognitive behavioral and acceptance and commitment therapy. And it also includes video blurbs and lessons from people I'm working with right now to get better from CRPS. So that is going to cost only what it would cost to see me like 2 times. And so it'd be like a couple $100, and that's it. And you have lifetime access, and I will always be updating that to be better and better. So you can go back and rewatch and relearn and hear these things over and over again. So that's going to be February 1st. That's version 1. Completely self-guided. So I'm not involved there outside of like answering questions on a forum. The second version is cohort or classroom style. So it's still an 8-week program, but every Saturday we would meet for a Zoom in groups of 20 to 30, and we will talk about the lessons in that module and how to complete the worksheet, and I'll give suggestions to individuals that need it. So that'll be a little bit more guided and together. So if you need something more community, that's going to be the classroom style version. That will be less than double what the self-guided is. So it won't be double what it is. It'll be less than double. So it'll be a couple hundred more than the self-guided one. The next option, if you go through these programs and you feel like I really need some one-on-one, I need some reassurance, I offer pain coaching. That is one-on-one customized treatment plans to help you guys get through this pain and get rid of the fear and anxiety around this condition. If that's something you're interested in, you can go to my website and click Get Scheduled. Also on my website, if you want to get notified of the program in February when it's released and how to access it, join my email list. This part is really important. When you join my email list, make sure to check your spam folder and click the verification button. If you don't click it, the emails might always go to spam, and I'd rather not have that happen for you. So make sure to check that. If you're getting my emails now, don't worry about it. But for some people, it might go to spam. So you got to mark not as spam. And then the last thing, the community hub. This is something I'm working on developing. It's going to be a hub where people can communicate and talk that functions a little bit better than Facebook, because the Facebook group is great and I'm going to keep that going, of course. But sometimes it's hard to like sift through things, or the responses get all jumbled, or you can't see all of them. So I'm working on some type of forum that will be a place for us to communicate a little bit better and easier. So there's
Nice.
that. And then last thing, this is my most recent video with the director of Trial by Fire. It's on YouTube. So go to YouTube and just go to YouTube and type Chase Teagarden CRPS, and you'll be able to find my page and find this interview, okay? And that's it. So we have completed number 4. Are there any other questions? And then I'll stop the recording, and then I can hang out a little bit longer as well, because I'm having fun. I'm hanging out. But are there any other questions before we stop the recording that someone would like
I
to
have
ask?
one.
Yeah.
Not just a question, it's more like maybe a suggestion. Maybe it's not on your part. I could check myself if necessary. A lot of these books, I have a problem reading. So I do audio books, and I'm not
Yep.
sure all these books that you're telling us about are audio capable.
Yep. The only one that I know of for sure is the placebo one.
Okay.
But the other ones on my list, all of them should have an audio version. And actually, since I prefer audio, if you go to my website and you go to the books section and you click on the blue part of the book where it's listed, it'll take you straight to Amazon, and it'll link you to the audio version.
Perfect.
Okay, so you will have
Nice.
no problem there.
I have a question.
Yeah.
Hi. I was wondering if you have noticed or if you see any correlation between autoimmune disease and chronic pain. I just asked because I mean, I'm almost 25 years in, and I was given low dose naltrexone,
Mm-hmm.
and I noticed that helped with the complex regional pain syndrome, and also an autoimmune diet
Mm-hmm.
has helped. And maybe it's more of helping calm down the inflammation and stuff. But I'm just wondering if you've seen anything correlation in that.
Yeah, of course. Anything that is affecting the whole body as a system has correlation or a relationship to CRPS. There's no correlation does not equal causation, but I do see people that often get told like there's something autoimmune going on, etc. I would recommend again the book When the Body Says No by Gabor Mate. I think that'll be somewhat enlightening, especially when it comes to autoimmune type conditions. Another book that is really good is called The Divided Mind by John Sarno. That's on my website. I think that would be really nice to read. But yeah, to answer your questions, yes, I do see correlation. But I wouldn't say that one is causing the other or anything like that, if that makes sense.
Yeah, and well, because I just see in the groups a lot of people, every time there's a new condition pops up, they think it's a cause. CRPS is a causation, but it's definitely not. I
No,
don't see it as a causation.
no,
Maybe there's a correlation because of the stress of the body or something,
yeah,
but it's definitely not causing all these other, like IBS or, all these
yeah.
other issues and stuff. So,
Yeah, it's not causing it. You're absolutely right. And I want to make this clear for you guys. When you see pictures in the groups, like sometimes there'll be a picture and it'll be a leg that's like black and there's scabs and there's all these things going on. It can be easy to see that and say, "Oh my goodness, that's CRPS." You don't know. We do not know the background, the medical history of the people that are posting these pictures, my heart goes out to them. Um, but I want to make clear that taking at face value what you're seeing in these groups as being quote unquote caused by CRPS, I wouldn't do that because you don't know, everyone is unique, different person. There could be something going on. They could have diabetes, they could have gout, you know, you don't know what's going on when it comes to the limb. So try not to blame CRPS on that, okay? Or that on CRPS, sorry. Trisha, I wanted to mention she said that you can check out audiobooks for free if you have a library card using the Libby or Hoopla app. You just need to enter your library card and it needs to be in their system. So try that out. Libby, Libby, or Hoopla, Hoopla app. And you might be able to find audiobooks for free. So that's an
Yep.
awesome resource.
Yep.
Else. Yeah.
Yep.
Chase,
You
I
can just
wanted to touch on
oh.
what she was talking about with after you get CRPS, like I got interstitial cystitis. Is that part of you and I talked about circulation issues, and I've gone on to like the NIH, what is it called? The National Institute of
Health.
Neurological whatever. And it says there's a direct correlation between CRPS and you know, circulatory issues. So can you touch on that a little bit?
If we stop moving, circulation does not do well.
What if you are moving and you're still having circulation issues and you've ruled out everything for that?
So I'm going to say this again. Correlation, even direct correlation, does not mean causation. So this is something we can talk about in the coaching, Kelly.
Okay.
But there's a correlation between swimming pools and drowning. But the swimming pool is not causing the drowning.
Okay.
A lack of ability to swim is what causes the drowning, or intoxication. So you can remember, guard your mind as much as you can when it comes to some of this stuff. Simplify, simplify, simplify. When it comes to some of this stuff, the antidote to complex is simple. So simplifying, or the opposite. And so I want you to try to remind yourself of that. Have you met anyone with Achari malformation and CRPS? Yeah. That's my answer. Or they'll have like sensitivity around where there was like a correction or something like that. But yeah. How would our PTs get into contact with you? So you can give them my email. I'll put it in the chat. They can reach out to me there. Actually, I would like eventually I'm going to go to pain management clinics and things like that and give them information on my program, and hopefully PTs will be able to take it as a continuing ed thing, because I think going through my program will be educational to providers as well. So it's dr.chase.tgarden@gmail.com. That is in there. Okay. You guys are awesome. I have loved another great Zoom. This has been really cool. Hopefully it's been helpful. I also want to just celebrate some of the wins that we've had with Amy. She went out and was snow blowing her driveway, something she hadn't done in a long time.
Best day ever.
Yeah.
Best day ever.
It gives you purpose and meaning, you know, and it makes you feel productive. And Cheryl, she went and had some lovely time with family. Kelly, she went and did a 360 under the legs dunk with her accordion spine. So that was cool. It's singing now, it's making music now, but she's gonna be all right. And then Matt, of course, he shared he went 2.5 miles on the Fitbit. And that is just phenomenal. I'm still blown away by that. And just more and more wins that we've seen. And Allison says, "No way. When I'm fully recovered, I'm letting my husband keep shoveling the driveway." Laugh out loud. That's fantastic. And I love the wording, Allison. When I'm fully recovered. So when, not if. Okay. Words have power. I meet people all the time that say things like, so for example, when I meet people with back pain, they will use the phrase, "I can't carry this anymore," when it comes to their emotions. What happens when you carry something really heavy for a long time? Your back hurts. Or they'll use the phrase, I thought I could handle it. And those are my hand patients, my CRPS hand clients. Or they'll say, I had a lot on my plate. And those are the people that I meet with jaw pain. So I want you to pay attention to the words that you use. Words are powerful. If you refer to your limb with CRPS as your bad limb, I would encourage you to start calling it left and right, because if you talk loud enough, it'll hear you. My family for a long time, they used to say, "Oh, I want you to be careful. You have a bad back." They would say, "Oh, don't move that. You have a bad back." And finally, I had to say, "Look, it's not a bad back. It's just a back." And that helped me, because every time someone would point out, "Oh, be careful, you're going to hurt yourself," I would tense up. So I want you to think about how you're talking to yourself when it comes to some of this stuff, okay?
Yeah, I've definitely changed the way that I speak about it. I no longer say my bad foot, my good foot. I say my left foot and my right foot. I've stopped doing that a while ago since we started chatting. I've completely changed that. So that's something, that's a shift that I've made, that I definitely have seen a difference since I started doing that. And I even do it at PT as well. When I'm talking about it, I say my left foot, my right foot. And like, I try to kind of just like change it just like in the environment as well when I'm there.
Yeah.
So
Yeah.
I've been doing that for a while.
I love it. I love it.
Yeah.
And Trisha was someone who thought she would never run again. And
Yep.
when she's doing better and when she's ready, I'm gonna go to wherever she is and we're gonna run a race
Yes.
together. Because I was told I would never run again, and I do it now, and so will she. One last joke. I work with teenagers, obviously, at the hospital, and this girl is about 16, and she said that I can't do that. I have bad knees, and I said we're gonna turn the bad knees into baddie knees, and she got a kick out of that, and then she was able to do it. So rephrasing and reframing is very helpful. So use that to your advantage. Otherwise, I would like you guys to wave at the audience and just say thank you, and I appreciate you being here. And I'm going to stop the recording, and then we can hang out a little bit afterwards.
Yay.
All right.
Thank you.
Of course. All right. I'm stopping the recording. All right. 3,